Order a meeting of the Hardeeville. Put the microphone on and try it again. Let's call to order a meeting of the Hardeeville Community Transformation Foundation. It is August 28th, 9 a.m. First item of business, call to order. Welcome. We're glad to have you all here. I know that Neil was giving you kind of a little bit of a rundown about today. First and foremost, thank you. We really appreciate you making some time to come meet with us today. I don't know if this is the first time, but I do know that this year we have received requests for funding that exceed the amount of funding that we have available to award. So by having these sessions, we get an opportunity to learn more about your organizations, what impacts you are having on the local community, and that information is going to help us when we have to make our decisions about those tough choices about who do we think the funding needs to go to and why. And so we really appreciate you being here today. We want to make sure that you have an opportunity to give us as much information as we may need, but we also want to be respectful to the other organizations that are a little bit later on down the list, because they will be shooting daggers at the back of your head if you go beyond 5-7 minutes. So just know that they're going to start glaring at you if we go a little bit long, but we want to make sure that you've got an opportunity to give us all the information that you brought with you today, and so we'll try to strike that balance. So with that, if I can get a motion to approve the agenda.
Motion to approve as read.
Motion's approved. Is there a second?
I'll second that.
Motion's approved and seconded. Any discussion? Hearing none, we'll call for the vote. All those in favor indicate by saying aye. Aye. Any opposed? The agenda stands approved. Next is the approval of the minutes. I understand, Neil, those will be coming forward at a future meeting, and we'll have a couple sets to approve at that time.
That is correct. Allows more time to get through with the actions today. So.
Then without objection, we'll go ahead and move on to the next section of our agenda, and that is presentations. All right, so Agape Family Life Center, you are up first, and you get to kick us off. Welcome. Thank you for being here.
Thank you. Good morning, everyone. Good morning.
Good morning. Thank you.
Thank you. Well done.
You're setting the bar high.
Sorry. Hi, good morning. Certainly, I'm Dr. Ponchetta Young, representing Agape Family Life Center as Executive Director. And just a little bit about Agape to the left. That gives a brief history about Agape. We've been in operation since 2000, built the facility in 2007, and so many other things to the left over there just kind of lets you know more about Agape Family Life Center. One of the things we're most proud of is our partnerships. We have several great partnerships that helps Agape. We're not a standalone agency. Many of our partners are right here in this room. Low Country League of Volunteers, Second Helpings, Low Country Food Bank, and you name it, several others are here, Bluffton Self-Help. What we mainly focus on, we focus on three areas: education, nutrition, and wellness. We're here today asking for funding for our education program. What does that do? We found out in Jasper County for about 17% of the students representing Jasper County schools scored below the academic achievement for the state of South Carolina. And that's in reading, language arts, and writing. In math, that number was even more appalling. It was, I believe, 13%. The overall school rating was at 40% for Jasper County students. What does that say for Hardeeville? We served last year well over 200 plus students in our facility at Agape Family Life Center with the after school program, the youth day camp, the enrichment summer camp, and also occasionally we would have what we call family engagement. Our family engagement, family comes together, they skate, you get to kind of have a little family bonding quality time. That improves the quality of life for our students, thus better preparing them for academic success. Additionally, for the Excuse me. Additionally, for students that we serve in Hardeeville for our education program, certainly across the board, the education, wellness, and nutrition, one that we are our most priority today is certainly the education, representing the schools of Hardeeville Elementary, Hardeeville Middle School, Royal Live Oak, and most recently Hartwood. This year to date, for this school year, 26-27, we have 42 students that are enrolled. You may see on the application that 90% represent Hardeeville. I'm proud to say 95% represent Hardeeville. Since that time, we've had new enrollments. Only 2 students actually live in Richland. The remaining of the students live right here in Hardeeville. And that gives you an idea here, the breakdown, Hardeeville 90, and so forth. Why is this so important to us? I gave you a little bit of history about the low improving academic status for Jasper County. That impacts Hardeeville. So many of our students, they attend Jasper County schools. We asked some of the teachers to provide us, 3rd grade is usually a benchmark to determine how students will achieve academically moving forward through 12th grade. This gives you an idea. The initials here represents the student's name. These are 3rd grade students. There was a 35% increase for this student on the SC ready score, I-ready test. The next one representing 33% increase, and the next one a 40% increase. Board, what I have shared with you in my application, all of the students that attended Agape Family Life Center Educational Services, and it gives you the breakdown of their grades, what their grades, how they improved or dropped. But most importantly, we wanted to show that there has been a 100% promotion rate, 0% retention rate. And although those numbers have been alarming regarding the school, we have seen improvement, and that's why I wanted to show the previous data. So the building capacity for our education program, certainly for this year, I mentioned earlier, we have 42 enrolled. We provide transportation to students from 2 of the schools who are not able to get to us. We provide hot meals to them daily. We have a reading specialist that really is so passionate about making sure students are able to improve their academic skills as it relates to reading. The purpose, how will funding would be used? So it's going to be used to offset direct costs for the educational programs. We're budgeted about $75,000 for the educational program. We typically run a little short, about $25,000. 20 to 25,000. This year, we've taken a look at what we need most, and we have it outlined in our budget in the application. But many of the things that we're looking for, the funding to assist us with the educational supplies and curriculums, the books. We purchased the bridge books. So many of our parents cannot afford that. We purchased that for them, and we utilize that type of curriculum throughout the academic throughout the education program. STEM products, we also purchase those items to make sure that students are receiving the materials that they need. Thank you.
Awesome. Thank you, Dr. Young.
Thank you.
Are there any questions from members of the board? Oh, I've got one for you, Dr. Young. In terms of year-over-year participation in the program, what are you seeing kind of as a trend? Are we gaining more participants? Are we losing participants? What does that look like for you?
So we are gaining participants. We've seen at least about a 10-15% increase. And I say that because there's a slide in the course with the age and the grades. Once they hit that middle school mark, eighth grade or so, they don't want to come to us anymore. They want to hang with their friends. But they're starting as early as 4 years old. Many of our participants start at age 4 at Agape, and we have the pictures that they've been there until age 12 and 13. And they come back as youth counselors to volunteer their services. We had about 5 this year to volunteer for summer camp. So we're still providing that mentorship even after they're no longer connected to Agape.
It's incredible.
The one question is that as they go through the program, are you guys tracking them further in education levels and stuff?
We do. Thank you for asking that question. We've had several students beyond high school, in college. Agape has been in operation since 2000. So now they have their own families, some of them. We've had one to graduate last year from Wayne State in Michigan. He's an attorney. He's a JD in the U.S. Armed Forces. We've had a couple of nurses. We've got a couple of teachers. And so we've been able to track that, just periodically staying connected to those families. Not only that, we have many that have graduated from high school, have attended school right here in the Low Country, TCL, working. Many are working, some's working for the city of Hardeeville, Jasper County, and so forth. And so they are being productive citizens for those that we have reached out to.
Any other questions?
Thank you.
Thank you
you.
so much, Dr. Young.
Thank you. Thank you.
All right. Next, we have the Beaufort Jasper YMCA.
Morning. Morning, thank you.
Morning, Mike.
I have the 7th copy if you guys still
All
need
right.
it. Thank you. Alrighty. Where is this going right here? That work? Okay. Short person. I'm going to set a timer so I don't overtalk myself. So my name is Julie Coons. I'm with the YMCA of the Low Country. I want you to know next year we're going to be feeling it in the alphabetical order. I was really grateful to see we were still Beaufort Jasper Y this year. So I want to start off by saying thank you to Agape. You actually made our conversation easier. As you know, we opened up James Fisher April 9th. And we started our summer camps and our child care over the course of the past several months. This summer in June, we started 6 sessions of child care that included almost 50 children, including teens. We have a teen program now. We know that teens and youth need these programs and they age out of child care. About 2 weeks ago, we got our licensure to start pre-K. I love hearing Agape's numbers because we don't have them yet. Having just started, we have to actually do crowd control. As you know, we're in that new East Argent track. They're a little bit in a resource desert right now as things are being built. They're all clamoring to us, and this is a pilot program with new staff, new licensure. So, as you know, we are asking for materials and supply. That goes for all of our child care program, but because our programs are enhanced programs utilizing our entire facility, that includes our curriculum for our classroom learning, as well as our active play. We do a lot of movement and mobility. We do fitness and nutrition as well. In addition, every one of our child care students gets free water safety, so they get free swim lessons, and we go through supplies and aquatics for our kids quite heavily. In fact, this year we'll be taking on Jasper County Schools and providing 200 kids with free swim. Last but not least, as you guys know, you funded our playground last year, $25,000, thank you. With that comes a lot of outdoor play, STEM, and other engaging activities and material, including sensory equipment for our playgrounds. We did start pre-K as of last week. We have a very small controlled group, 10 kids. As of January, we'll be opening it up. We have licensure to take 76 kids, but we think this year we'll probably do 2 classrooms, so it'd be a max of about 50 kids. We'll be able to give you much better impact data after we go through our first year. This is a pilot program for us, and we'll be able to give you a little bit more information, in particular on what's going on in that East Argent development. Let's go on to the rest, I guess, of these slides. Okay, so just a little picture so you understand. When I say material supply and equipment, we mean the paddle boards, we mean the noodles, we mean the curriculums, we mean the pens, the pencils. A lot of the things are our first time startup costs, so things like board games, STEM equipment, and aquatics equipment in particular. Last but not least, I know it's a little bit hard to see, it is included in your packet, whom we've served so far, up to 60 kids between our, guess I talked too long, including our summer camp. I did include our rate schedule. As you know, we do financial assistance. Any questions?
Any questions by members of the board? I've got one for you. So I know you're going to be, you mentioned working with Jasper County School District. What does that relationship look like?
Presently, we just started, actually. I believe you guys just met yesterday?
We
Yeah.
actually had a great conversation yesterday with the superintendent and their key staff. So there's two things we're working on with them. One, or multiple things. We're giving them a corporate membership for all their employees. But the big things is we're going to be doing every second grader. They have about 250 second graders this year at both sites. We'll be doing free swim lessons over the course of the year for all their kids.
Okay.
And we're just setting up, busing, getting them to the facility so we can get them through the lessons. And then also we will be offering them some slots for their childcare for their employees as well. So we're gonna set aside some space for them. So we're working heavily with them and also with Hartwood down the street as well. We're doing after school with them. We have over 100 kids in our after school for that site. And then we have, we're gonna be doing free swim lessons for all their second graders, and they have about 125, I believe.
Awesome. Thank you, Mike.
With your childcare services, the cost to attend as a participant, is that on some sort of ranged model or something of that sort?
Yeah, our base is at cost, right? We're a nonprofit. But then we subsidize on a sliding scale, and that's income contingent. So I will tell you, though, that we are starting to take zero at $0, little by little, and as we can afford to do it.
Do you have an idea how much that costs you per student at this point yet, or?
So the cost for us per student is somewhere around $600 a month.
Okay.
We set it up kind of in a three-way system. The parent typically does contribute about a third. We raise donor dollars through our private donations, but we also do sponsorships out of corporations as well. Right now, our scholarship campaign overall is about $400,000. We've spent $350,000 of it already, so we're going to have to raise more just to get through the end of the year. That's association-wide, though.
Sure. Any other questions? Thank you so much, Julie. Appreciate you being here.
You guys want this?
Yeah, I was gonna say, happy to take any extra copies that you have. Thank you. All right, next on our list is the Bluffton Jasper County Volunteers in Medicine. Welcome and good morning.
Thank you.
Thank you very much.
I'm sorry. It was first up last night. Yeah, no, it's
We'll get
not.
that date, Pam.
Yeah, that's what I tried to do. I'm sorry.
No, you're okay.
Always has to be someone, doesn't it? There you go.
There you go.
There we go. Sorry. Great first impressions, right?
We have all been there.
That's right. Don't worry about that.
So sorry. I only have one time to do that. Thank you so much for having me. I'm Pam Toney. I'm the Executive Director of the Bluffton Jasper Volunteers in Medicine and have been with them now for 13 years, which is hard to believe. So now we'll see if I can do this right. Okay. So we are one of 100 volunteers in medicine throughout the country. Each volunteers in medicine is individual. We don't work with others, and so I need to make that very clear because while we certainly do appreciate all and envy everything that Hilton Head volunteers in medicine do, we are completely different from them. So our mission of the Greater Bluffton Jasper Volunteers in Medicine is to provide free medical care in a compassionate and professional manner to those that live in Greater Bluffton and Jasper County. And we are a true free medical clinic, which means that we do not charge any fees for service, as opposed to a federally qualified free clinic, which is on a sliding fee scale. What we don't have at our clinic, what we're not able to provide at our clinic, we then go to other agencies, other hospitals, other doctors to help us, and we always pay for those visits as well. We are very careful in how we manage our patients to make sure that they don't have any insurance. We don't take anyone with insurance, and they have to fall within guidelines of 250% above the poverty level. So in 2011, when we started the clinic, when we worked with Volunteers in Medicine, which was at that time was a national organization, in order to become a Volunteers in Medicine, they required us to not only care for those in Bluffton, in Greater Bluffton, but also in Jasper County. And so we knew that at some point we would need to get into the Jasper County area. In 2014, we developed a focus group to see where that clinic should be. And at that time, we decided that it was most important for us to be in Ridgeland. That was sort of a central location. In 2013, our clinic had grown so much that we decided we needed to look for additional space. And at that time, we were in a strip mall that had 4 units to it. A daycare center was in 2 units, we were in another, and the third one was open. We had a great relationship with the owner that gave us a wonderful fee for rental, but then when we wanted the 4th unit, the price just tripled. And so we decided we needed to look for another location, but we loved where we were, and so we were able to purchase the building. And through grants and through community help, we were able to purchase it, remodel it, and last year we spent over $1 million in doing this, and all that was raised through grants and donations. Our Bluffton Clinic, of course, is our main clinic, our largest one, and you can see here all the different facilities. Lots of times people think all we are is a primary care, but we truly believe that if we have other specialties, then our patients will stay with us, because transportation, as you all know, is an issue, and if we've got to send them somewhere, the likelihood of them going is pretty rare. And so by keeping all these specialties here, we can keep our patients with us. You notice also that we have a pharmacy, we have a full pharmacy, and again, our patients are not charged for that. When we expanded our services in Jasper County, in our Ridgeland Clinic, we expanded to include primary care, endocrinology, cardiology, gynecology, orthopedics, and podiatry. Then we also do a telemedicine program for mental health, and we also have our main optometry clinic in Ridgeland, which does basic eye exams, and then we have a specialty ophthalmology clinic in Bluffton that does retina testing and then ocular pressure. We also, again, have that pharmacy, and then we do a patient's assistance program. You can see at this chart here in 2014, our unique patients were right at 1,800. Right now, last year, we're over 8,000. And so these are patient visits, which is incredible to see how we've grown. We started with a budget of $285,000. Now our budget is $1.2 million. And again, that all has to be raised. We had 1,943 unduplicated patients, unique patients, and of those patients, 478 came from the Jasper County area. Again, they visited us over 8,000 times, but over 2,000 of those visits, again, came in Jasper County. And so now we're looking to see that we are having a variety, more patients in the Hardeeville area. We keep hearing how you all are growing, and we're trying very hard to meet some of those growing needs that we feel that we will have more patients. We are not at the position at the moment to open a clinic in Hardeeville, but what's exciting about it is that we feel that by working with and collaborating with other agencies, we not only use your money more efficiently, I think. But then that also helps us to see what the need will be moving forward. And so by collaborating with Bluffton Self-Help, which I still like to call them, but I know they're renaming to Self-Help, we'll be able to have a space in there that we can go and work with potential patients at least once a month. And then our podiatrist will go and do diabetic education quarterly. While we're there, we will be able to make sure that the patients or prospective patients can fill out applications. We can take their documentation, and we also can do annual reviews. So once they become a patient of ours, we can go back a year later and help them with their annual reviews to make sure that they still qualify. We hope to be able to do blood pressure screenings. We hope to be able to do education. And then, as I said, specifically our diabetic education. We have a wonderful community health worker that will travel there and also help with education programs. We believe that by doing this, we're connecting more people with our services. And a commitment to the area. We're also having a wonderful fundraiser in October that we love to talk about, and that will be specifically for our Jasper County area. And so we believe that working together, we can certainly make our community better, and appreciate this opportunity to speak with you.
Wonderful. Thank you, Pam. Any questions from members of the board?
I do. Do you have a general percentage consensus of the Hardeeville patients?
I knew you were going to ask that.
Yeah, I think you've got 478 patients out of Jasper County. So
Right. So as I'm sitting there, I'm thinking, I would say we probably have 100 patients at the moment from the Hardeeville area. The problem, or not problem, but the issue is that some of them go to our Bluffton clinic and some of them go to our Ridgeland clinic.
thank you.
Pam, do you see that transportation is a big issue, trying to get patients to the Ridgeland or Bluffton?
It's a
clinic?
huge issue. It really is. And we believe that by having this satellite clinic of sorts, that would help a little bit. Because right now, if you become a patient, you have to come to the clinic to pick up the application. You have to come back to the clinic to drop off the application, because then we check to make sure the patient qualifies. And then they come again to visit, to have an intake before they even get their medical visit. So by having services in Hardeeville, we will eliminate 4 trips before they actually see the doctor.
And one additional thing on services offered, I didn't see radiology. So what happens if they need radiology services?
So we team up with the hospitals to do radiology, and then again, we pay for all those services. They do give us a reduced rate. I have a wonderful nurse liaison that works with the hospitals to get reduced rates for us, because again, we pay for all those services.
Any other questions?
Thank you for this opportunity.
for coming
I
this
appreciate
morning.
it. Sorry for the glitch, but maybe that'll help you remember me. So.
All right, next up, we have the Boys and Girls Clubs of the Low Country. Welcome and good morning.
Good morning to you.
Thank you.
Thank you, Rob.
Thank you.
Thank you.
Thank you, Rob.
All right, first of all, just thank y'all for having me this morning. Representing the Boys and Girls Club of the Low Country. We want to have an emphasis on a STEM program launch that we're looking to do in Hardeeville Elementary School. So far we have about 105 registered at Hardeeville, with an average daily attendance of about 85. So another measuring tool that we use is what we call impact hours. Impact hours are how many hours we physically have the kids in the building. In the summertime, that was over 30,000 hours that we had the kids in the building. And for after school was about 25,000. So, and this again was with a 105 register with a average daily attendance of 85. Some of the STEM pathways that we're looking at are on four main cogs. That is, one, being at Hardeeville Elementary in school, we want to do hands-on enrichment. We want to make sure we have that digital literacy and problem solving, STEM-aligned careers, and economic stability. We feel like this builds the skills that's needed in this time, right in this place. It teaches advanced manufacturing, IT, healthcare, transportation, logistics, construction, and engineering, and leads into things like coding. And it's something that the kids enjoy. It's something that we looked at out of all the things we do, Power Hour, STEM, and any other educational / fun things we do with the kid. This is something that they enjoy the most. Our project scope around three things: a strong foundation, daily after school and summer, high yield STEM, that is media making, that is DIY STEM and ultimate journey is our main ones. Two, we want to build on that success. How do we build on it? We target the skill pathways that compound over time. So we find things that they actually enjoy and we do what they like to do. Again, it's not a thing that we allow them to do whatever we want. But what I like to say is, tell me what you like, we'll make it work and we'll make it happen, because this is their club at the end of the day. Lastly, we want to elevate impact. We do that by our partner and community integration beyond what we just do at the club. That is school alignment, which we're already in line with the school in the district in Hardeeville Elementary School Monday through Fridays, and family STEM nights and showcases. With that, we're able to show the kids' work in progress not only to their families but to the community as well. We build it on that infrastructure of staffing, programming, materials, space, and solid policies. What we're asking for is $25,000 to this STEM launch. Most of that would be laptops, Chromebooks, main thing being a dedicated space with furniture and things of that nature that they can just do STEM in that area. Again, the partnership with the school allows us that dedicated space. We have had a pretty good partnership as far as the principals and the superintendent goes. So our rapport is pretty good there. Four main things on that is hands-on STEM experiences. This also gives them digital access for every member of the club, that dedicated lab environment that we talked about earlier, and staff capacity, which equals youth motivation, meaning if we have our staff and they're able to be trained, they're more effectively able to run this program with our kids. So how this improves services for Hardeeville? We want more than 70% of our youth that are enrolled to meet and exceed in the annual benchmarks of math and science. Infrastructure, we want to close that educational service gap. That time that they're not in school, we're open. And we're in the time that they're not learning and they're not actively in classrooms, they're with us and they're still learning different skills, specifically STEM in this area. And also goes for summer as well. They're with us for 10 hours in the summer, Monday through Friday, for 6 weeks. Workforce, we want a future-ready talent pipeline. We understand that Hardeeville is growing at a rapid rate. We want our kids to grow with it and be prepared as they step out of school and enter the workforce. Safer afternoons, 3 to 6. Those are the times when parents are still working. Those are also the times where kids are most likely to find trouble because they don't have that supervision. We're open during that time, making sure they have that safe environment. Public-private coalition, and civic identity. We want a forward-looking Hardeeville. We must have our kids grow at the same rate as our community grows. And we do all this with no transportation this last year. So parents have been picking up and making sure they get to the club. They get to the club for school, but they have been picking them up, taking them home. In the summer, they make sure they get there in the morning and take them home in the afternoon. So this is without transportation. So we have had a sustainable base of kids and families that have bought into what we're trying to do. So thank you very much.
All right. Thank you, Rob. Any questions from members of the board?
Rob, currently, how many kids are you serving at Hardeeville Elementary?
So we have about 85 right now.
85?
Yes, sir. About 85.
Do we ever look and see that you all in Agape, do you ever see who kind of cross references and does kind of both programs?
Literally, me and Serena were just talking about that, so I was planning on talking to her right after this. So, but yes, about 85, and we are able to provide that for free. This would be a funding gap that we need to meet in order to have the STEM program.
Now, does the school district itself provide devices? Do they provide devices for them to take home at all, or?
Not to take home. No, that's kind of the bridge that we meet. They don't allow them to take them home, but they allow them to do Lexia and iReady and things of that nature.
Okay.
But this would be something that would be in correlation with the school, but at the same time they're able to do that and have those necessary laptops, Chromebooks, and things of that nature without having to worry about whether it's school property and things of that nature.
Question for you, Rob. Knowing that this is a new program that you're looking to kind of start up, how are you going to evaluate the effectiveness, particularly with the investments in the STEM program? I know you've referenced kind of a metric here for the youth that are going to meet or exceed annual benchmark on, it looks like standardized testing. Is that what you're going to track, or how do you plan on measuring the effectiveness of this program?
So we track that through multiple things. Like you said, there's testing, but it's also through our Lexia and iReady program, which is also in the club. And it keeps score on if a kid is on track, exceeding, or falling below. We have throughout this last school year, we were at a 90% meet standard with our kids. And this is through Power Hour, which we call our homework time, which is, I tell them, is my only non-negotiable in the club. You have to do Power Hour. And it has been effective because the kids, they understand that, hey, if I do this, there's something on the other side for me. We have a routine to where, hey, if you do your part, got something for you on the other side. So, but that's how we'll measure it through Lexia and iReady.
Perfect. Awesome. Any other questions? All right. Thank you so much, Rob. Appreciate you being here today.
Thank you.
All right. Next is Community Foundation of the Low Country, the South Carolina Nurse Retention Program. Welcome, Bob. Good to see you again.
Good morning, everyone. Bob Elliott. And
Good morning.
I'm representing
Yes,
the
sir.
South Carolina Nurse Retention Initiative. We're partnered with the Community Foundation of the Low Country, as well as healthcare providers in the area and local and national nursing schools. So that's why we got the C in front of the S, community. Let me see. Well, this is an active mouse.
There, we got it.
So, we're supposed to advance this here. There we go. Growing the nursing workforce for a stronger community is our mission. Increasing nursing staffing in hospitals, hospice, home care, and schools expands access to quality health care for the city of Hardeeville citizens. A robust healthcare system supports local businesses and economic development in our area. The program provides financial support to new nurse graduates coming out of USCB, TCL. It's a financial incentive for them to remain here in our area, employed with one of our wonderful healthcare providers. If they leave the area, then the payments stop. but it is $6,000 over 2 years for an associate degree nurse and $9,000 for a BSN. They can use the funds for whatever they need those funds for. Most of them use the funds for further education, just covering the high costs of living, addressing the affordable or lack of affordable housing that exists in our area. So a wide variety of uses. Increasing the supply of nurses improves the nurse-to-patient ratio, which is going to deliver tangible community health improvement benefits. Fewer medication errors, lower patient mortality, shorter hospital stays, reduced admission costs, and higher patient satisfaction. Every nurse that we add and keep in our area will care for up to 5,000 patients per year. So the multiplier effect in just the addition of one nurse is huge. We've added 90 nurses in the last 5 years. So today I Googled Indeed.com, and there are over 500 RN jobs that are open within a 25-mile radius of Hardeeville. That's what we're facing now. And on top of that, we have some wonderful new healthcare capacity coming into our area with Beaufort Memorial, Novant Coastal Carolina, Agape, hospice and home care facilities are expanding. It's wonderful to see. But we need the staff. We need the staff and that's physicians and nurses. So on top of the shortage that we've faced since COVID days and the 500 that I mentioned today, we've got a huge opportunity ahead of us to staff those new facilities. I wanted to show you some of the healthcare providers that we're currently supporting with nurses and nurse retention. You get an idea of the mix from home health to hospice to hospitals, if you will. And our goal moving forward is to raise $200,000 specifically for Hardeeville and the greater Bluffton area so that we can add 20 to 25 nurses in the next 12 months. So I mentioned that we've added 90 nurses over 5 years. We're trying to double the impact that we're going to have in the next 12 months. I want to add 70 nurses across the 4 counties that we support, but specifically 20 to 25 in Hardeeville. So I want to just conclude by thanking you and summarizing the services that we provide. We're providing services through the nurses we recruit to the citizens of Hardeeville. We're providing services to the businesses that need a robust health care system to attract their employees and to grow. And we're also supporting, obviously, the healthcare providers. And finally, we're thanking the nurses for joining the profession and for caring for all of us. And with that, I will also give you a little pin that I give out to the audience that I present to and ask you to give this pin to the next nurse you see and thank them for their service. Thank them for caring for us here in the Hardeeville area.
Thank you.
Thank you.
They're different colors, so you can see.
Thank you.
Thank you. Thank you.
All righty.
Happy to address any questions.
Wonderful. Thank you, Bob.
Awesome.
Any questions by members of the board?
Yes, I have a question.
Yes, ma'am.
What are the number one driving forces that you see from the nurses as far as challenges for them to come to our area? Is it that they have an issue with schools, that they might have cost of living? What is the parameters that you're working with them to see what that main challenge is and how we can definitely bring them into our area?
Yeah, it's all of the above. It's lack of affordable housing, it's transportation, it's commute time to the island if they're, looking at Novant there. It is a desire to leave the area if they're from here and go work in Chicago or Charleston. It's a whole variety of things. It's very difficult. The recruiters for Novant, Buford Memorial, and everyone are very, very active right now. Job fairs and so forth to try and encourage them. One of the other issues is the students that come up from to attend TCL are from Savannah. A lot of them are and they're going back home. They're not planning to work here. They're just getting their education. So I mentioned the partnership with the colleges. We all share the same goal, and that's to retain more of those graduates here locally, whether it's nurses or electricians. It's the same phenomena, whether it's a nurse or some other profession in many cases.
Thank you.
So we're just trying to help them overcome some of these barriers. The $9,000 is a significant amount of money, given what their salary is coming out and the student debt that they're faced with after 4 years of education.
I just have a quick question. So all of the medical facilities that are going on in Bluffton, is there a proactive in trying to bring nurses and doctors here from all over, I guess, because those are going to be substantial?
They're recruiting from my home country of Canada. They're bringing them in from Europe. They are actively recruiting nationwide and internationally, yes. The two hospitals you mentioned, just Buford Memorial and Novant in Bluffton will require a minimum of 100 nurses that don't exist today. And Buford Memorial's getting set to start up. Novant's probably a year behind them.
I have one more question. Do you all have a big uptick with travel nurses? Kind of that trend. I have a few friends that are nurses, and they literally will travel around for a different time, so they get to see different parts of the country and stuff. Is that something that you all are seeing as well here in this area?
The traveling nurse, I guess, phenomena began in the COVID days, and it's diminished a lot. So the more experienced nurses are still attracted to that traveling nurse profession. The new grads are getting placed in ER and in hospital settings. And after 3-4 years, and some of them are moving into hospice as well after that training, if you will. But it takes a while, 4 or 5 years perhaps, before they even start considering the traveling aspect of nursing.
I have a question just about the traveling. So if you have traveling nurses, is that something that you can incentivize them to stay, just like this program? I mean, I know they're not graduating from here, but is it something that can get incentivized?
Yeah, we don't have any traveling nurses
Okay.
on our program. We're recruiting the new grads, okay? And every 6 months, they have to complete a verification of employment process. So they have to show us a pay stub that says, hey, I'm still working at Novant, Coastal Carolina. And then we'll write them a check. So we do that over 2 years.
Okay.
And so they're not traveling. They're full-time
Good retention.
in any one of these healthcare facilities.
Bob, can you really quickly describe your process? How do you select the nurses at Coastal or whatever that you're selecting for our program?
Excuse me?
How do you select the nurses that you give out the monies and stuff to? So
Oh, we have a selection committee. As a matter of fact, we will be evaluating, we just completed an application process September 1 will be completed. We have 20 nurses that have applied. Our selection committee will look at the 20, and it's about funding. And luckily, fortunately, we have enough funds to support all 20 if the committee, the selection committee, deems them worthy, if you will, or eligible.
That's
Put it that way.
impressive. Congratulations on that. It's a big win.
Thank you.
Any other questions?
For a two-year cycle essentially is.
It's a 2-year retention cycle and confirmation, verification every 6 months. Yeah.
Any other
And
questions?
I would say, I didn't mention that, but our retention rate is about 90%. So we are measuring the retention while we're paying them for the 2 years, and we're measuring retention after the payments stop. And they're both in that 90% range.
Awesome. Thank you, Bob.
Thank you.
All right. All right, next on the list is Family Promise of the Low Country.
Going to close this for the next speaker. Hopefully it'll just override it when you plug it in. Or you can give it again.
Good morning, thank you.
Good morning, thank you.
Good morning. Thank you.
Perfect. Good morning. I am Haley Green with Family Promise of the Low Country. There are children in Hardeeville whose families do not have a home. They may be sleeping in cars or couch surfing. We may not be aware that they're homeless because they're not standing on the side of the street. However, they do exist, and many of their parents are working. Freedom House is a place where those families can turn. It is the only shelter in Jasper and Beaufort County serving families with children under 18, and it's right here in your city. The face of homelessness is changing. Across our 2 counties, up to half of the households don't earn a livable wage, and these are working families who still cannot afford housing in our area. When housing becomes unstable, children are the ones who feel this disruption the most. Freedom House is more than a place to sleep. When families do need shelter, they can stay for up to 90 days in a private family bedroom at Freedom House with a case manager supporting them. After moving into permanent housing after shelter, families receive a year of stabilization support, which includes intensive case management to ensure all barriers and causes of housing instability are addressed. We keep families together under one roof with dignity. And we do it right here in Hardeeville. We began serving Hardeeville families in 2024 when we purchased Freedom House and opened the shelter here. In 2025, we expanded all of our programs to Jasper County, which includes prevention, diversion, stabilization, and the shelter. We didn't move into this area to recreate services that already exist. We're trying to meet a need that is not being met. We partner with other organizations in the area. Agape, Mercy Mission, and local churches really support us in feeding our families throughout the week. The model does work. 91% of families who complete the stabilization program remain in permanent housing 12 months later. And that is our goal. Our goal is long-term stability. Every adult in our shelter is working or seeking work. We are careful stewards with 83 cents of every dollar going directly to programs within our organization. We track housing placement and retention, employment and income growth, and follow-up outcomes for every family. So today we're chatting with you all with a request of $25,000 toward the program, which costs us $171,000 a year. Your investment would be part of a greater investment community. We have private donors, foundations, and other grants that help support this work. This grant would support our shelter operations, case management and family support, transportation, parenting and financial literacy classes, and housing stabilization. Every dollar will stay local. Freedom House gives Hardeeville families a place to land and a path forward. It keeps children together with their families and helps parents build lasting stability. We do the work with the support of this community, and we'd be grateful for your investment in the work here as well. Thank you.
Awesome. Thank you so much. Any questions from members of the board?
I have a question. How many families can you take care of at a time?
We have 6 private bedrooms within the shelter, so 6 families at a time, up to 90 days. Not all families will stay the whole 90 days, so it kind of varies year to year how many families can pass through, but it's 6 at a time.
Thank you.
How are you supporting in that 90 days? Any of like the mental health issues that might pop up from that stigma of being unhoused,
Absolutely.
especially with like kids and stuff?
Yes, we don't do direct service in the mental health field, but we do work with community partners to provide that support for families. Again, our lane is housing stability, but then we're reaching out to network with others to
Partnership.
address the entire family. Like stability includes so many things. It's going to be income, mental health, keeping kids in school. I mean, we're working with all the community.
All of them. Oh, that's wonderful. I have another quick question. Do you all have any expansion plans? I know the numbers are continuing to rise as, even when Hardeeville grows. I mean, there's always that opportunity with cost of living is getting so high. So do you all have any plans for expansion?
We do. Not necessarily directly with shelter. Kind of the next thing we're looking at over, I would say, the next 2 to 4 years is transitional housing. What's really difficult, we're thankful for the stabilization we can provide, but a family can do everything right in shelter, and the day they move out, can't afford housing here. I mean, that's a real problem. So long-term, we're hoping to do transitional housing. We would own that housing. It would pass through us. We would do, a sliding scale rent with families, and that would be for 3 to 5 years.
Okay.
What are the situational trends that bring families to the program? Is it lack of loss of job, or is it divorce, or
What we're finding with working families is you're living paycheck to paycheck. So really, it can be any emergency that can set them off. And, it can be medical. It could be job loss, looking for a new job. Your kids are sick and you miss work for a few weeks. We see all of those areas. The problem is once they're behind 1 month, they cannot catch up. So they'll come to us 2-3 months behind, and now you're looking $5,000-$6,000, and we can't cover that. Like none of us together can cover that, and so that's what lands people.
Any other questions? All right. Thank you so much for being here this morning. Appreciate the information. Alrighty. Next up on the list is Jasper County Council on Aging. Good morning and welcome.
Good morning.
Thank you.
Thank you.
Oh, you're fine. Thank you, ma'am. Thank you.
Thank you.
Good morning, council members and city staff. My name is Lila Rush. I'm the director of Jasper County Council on Aging. well, excuse me, I'm trying to see how I move this thing. Okay.
There we go.
I'm here representing our nonprofit organization dedicating to serving the senior citizens of Jasper County. We proudly operate 3 senior centers that provide meals, wellness activities, educational programs, social engagements, and access to resources that help older adults remain healthy, independent, and connected to their communities. We serve seniors throughout the Jasper County, including many residents of Hardeeville. As our senior population continues to grow, so did the cost of providing these essential services. Rising expenses for food, utilities, transportation, program supplies, and facility operations have placed increasing pressure on our budget. While we work hard to secure grants and community support, those funds alone are not enough to meet the growing needs of the people we serve. We are requesting the City of Hardeeville support and help offset our operating expenses so we can continue providing these vital programs without reducing services. An investment in the Council on Aging is an investment in the health, dignity, and quality of life of Hardeeville's older adults. We serve approximately 200 seniors a day to congregate home delivered meals throughout our county. We have clients that are homebound, and sometimes the driver is the only person that they see that day. Some may have not more than that meal a day to eat. Your support is really appreciated by our senior citizens. Our seniors built the communities we enjoy today. They deserve opportunities to remain active, engaged, and supported as they age. Your partnership will help ensure that our seniors remain welcoming places where seniors can be friendly, can find friendship, nutrition, meals, education opportunities, and assistance when they is most needed. On behalf of the Jasper County Council on Aging and the seniors we serve, thank you for your time, your consideration, and your continued commitment to residents of Hardeeville. We appreciate the opportunity to partner with you in a meaningful difference in the lives of the community of older adults. I also want to say that one of our senior centers is right behind you. And next year, I plan to apply for a grant with the state to expand that building. The building is pretty old. I just did a grant for the one in Ridgeland, and we got a new roof. So I did find out that through the state, you have a grant you can apply to expand buildings. And that building is very cramped. If any of you have been back there, I don't know. So with your help, we could continue to grow and continue for our seniors.
Wonderful.
Thank you. Any questions?
Yes. Any questions from members of the board?
I have a couple.
Yes, please, go.
What is your number one need that you're seeing for the seniors?
The need is food, basically food and transportation. We get so many calls, people calling for us to provide transportation to doctors and things like that. When I first came to the center about 12 years ago, the state did provide us transportation money to take the seniors to doctors in Hardeeville and Hilton Head around the area. But they discontinued. With all the government cuts, the new administration, they cut the senior programs considerably this year. And we had people on a waiting list for well over a year. We just got it released. So I'm starting to take people in. Also, we have a lot of older seniors that come to the center, and we cannot attract 60 and 70-year-olds because a lot of them are still working, including me. And that's a hard situation there. We have a lot of homebound people that can't get out, so we do the home delivered meals. In Hardeeville, one of our problems is the roads are so busy right now, and we go into a lot of, sometimes we even go into the gated communities that deliver meals. And just down those long roads and back, and we're timed with our meal temperatures and everything. We have to deliver at a certain amount of time. So that makes it a little bit difficult.
Okay.
But that's what I would say, transportation and
Food.
food necessities.
How many of the meals that you provide out of Jasper County, do you know what a good percentage of is for Hardeeville?
Hardeeville, we have about 30 people on our congregate roster, and we deliver to 27 around the community. And we do 2 routes. We have kind of a little local route because we have to go out all the way out through Levy, through down through Walmart, the whole end of this county.
It's a big city.
Yeah, and it's not that we have so many clients, it's the timing of getting the meals to everybody on time.
Makes sense.
What is anything that the community can do to help, whether it's to sign up for volunteering for Meals on Wheels, or if it's volunteering to sign up to take a senior to an appointment? What are some things that you all are saying that you're working with partners to be able to help facilitate some of these issues that you're seeing?
One thing would be helping to take seniors to things. We do have the local church in Ridgeland who have been with us for over 20-some years. They do a route for us in Ridgeland, and they actually use their own vehicles, their own gas. They probably have about 11 people they serve in that area. It would be real helpful to have volunteers, someone in Hardeeville that would actually do that too. Like, this is a church, this is St. Paul's Methodist Church that does that. If we can get one of the churches to volunteer to do a route, it would take a big relief off of the 2 drivers we have from back here delivering,
Good to know.
So,
Thank you.
okay.
Any other questions?
How many people actually come in person back here at this building on a daily basis?
I'm supposed to have 25. I had to sign a waiver with the state. I have 25, say I have 25 on the roster, but doesn't mean 25 come every day. Now they'll come on bingo day, big time bingo day. Everybody comes for bingo to get prizes. But maybe about 18 a day, except on Tuesdays. I don't know why it's very slow here on Tuesday.
So have you thought about running bingo more than one day?
No, according to the state, we're only allowed to have it one day. They play a lot of games, and they do a lot of activities and crafts. And Robertville does great with their quilting. They have they're the quilters. They do quilt back here too, but I'm also looking for a volunteer to do. I have a quilting room also, where I'm looking for a volunteer for Ridgeland to come in and teach quilting or crocheting, something. But nowadays people want to do more active things too. We don't want them just sitting in their chairs. So we were thinking of, we do bingo size, which is a different kind of bingo, and it's an evidence-based program that we do with the state, where you have to do exercises and it gets timed, and then you give a little speech and talk about things, and then they answer the questions. They have to stand up and do this and that, for so many long. They love that, and then they get prizes.
That's awesome.
Thank you.
Any other questions?
Thank you.
Thank you so much for being here. All righty. Moving right along. Anybody on the board, we need to take a quick 5-minute comfort break? Are we still good? Good? Okay.
Just with me.
So next we're going to have Low Country Legal volunteers.
Thank you.
Good morning.
Thank you.
That's half the battle.
That's it.
This is what I lay awake at night. Thank you guys for allowing us to present today. I'm Ann Kaywood from Low Country Legal Volunteers. So honored to be here. Excited to tell you about our new project. So we've been around for 26 years, serving Beaufort, Jasper, and Hampton counties. We do everything from housing and eviction defense to simple wills to family law, birth certificate amendments, and many other things that our community needs, those basic legal services. The folks we serve live at 200% of the federal poverty guidelines. So, for example, a mom of 3 can make $66,000 and still qualify for our free legal services. So year to date, we have served 64 Hardeeville residents, including referrals, represented folks, and resolved matters for 40 folks in Hardeeville. And then provided 130 plus hours of free legal assistance to Hardeeville residents. 100% of the cases are with favorable outcomes. So that's not always the case, but proud to tell y'all that here today. So with this new grant, we project that we're going to actually serve 50% more Hardeeville residents because we're not going to do it alone. We're going to do it with trusted partners and some key staff members. So here's the overview, year to date, pretty much. 40 Hardeeville residents were served. We did wills and healthcare powers of attorney for 21 folks in our area. Family law matters, 13. Birth certificate amendments, 3. And a lot of folks can't get services and benefits for their children, so that's why we do that for local families. Domestic violence restraining orders, I'm happy to report only 1, but we know that we're there for people if they're facing that. Housing protection and eviction defense, 1. And other. We have held 3 free community clinics and served over 125 attendees at those clinics. The one below is a Justice Navigator training with a lot of folks from the Hardeeville community represented in that training. And the top picture was a Fresh Start New Opportunities Clinic at the Hardeeville Library with our staff represented, but also the solicitor's office doing expungement services. So again, through August, we've been able to serve 165 Hardeeville residents with our free legal services and education. So what are we asking for? We're asking for $25,000 for several things that will improve the lives of Hardeeville residents. The total program budget is $75,000. And what we're looking to get funded here today is hiring a part-time community ambassador with strong Hardeeville connections. And let me think, who has the strongest Hardeeville connections that I'm thinking of right now? Oh, there's Dr. Young. So we know as a free legal service provider that we can only go so far. We have to build trust, we have to have connections, and we have to have local representation. So we've been in talks with Agape Family Life and Dr. Young to be able to provide those services and hire a community ambassador. What's that going to do? So ultimately, what it's going to do is what it's done in Hampton County. We were able to hire Reverend Arlene Dunbar in Hampton County, and our service level within less than a year went from 3% for 25 years of Hampton County residents served to 11%. So we know this method works, and so that's why we are seeking to get funding for that, because we will know it will work and we'll be able to serve more people. So we also have a dedicated community justice advocate we just hired last month, Julia Papel. She was with Beaufort County Human Services Alliance and has a social work background. So she's going to be able to serve the whole client, and we would dedicate a third of her time to Hardeeville residents. We just met with Tess Hogue, the new library director in Hardeeville, and she's going to be able to provide us with an dedicated office space that we can reserve by appointment. So we're very excited for that new development. We will also continue our Justice Navigator trainings in Hardeeville. Current one we have coming up is October 13th, right after the Families in Transition Fit meeting at Agape Family Life. Very excited for that. We also have a clinic coming up October 3rd with self-help here in Hardeeville. So we have also the funding to provide services for multilingual outreach materials, workshops, and referral systems. And our community justice advocate, Julia, also happens to be bilingual. So that's just one more connection to our community members here in Hardeeville. It will also include volunteer recruitment. We sorely need volunteer folks from Hardeeville. That would make a huge impact on the work we do. We currently have 21 volunteers, and we have about 3 that are from Hardeeville. So we'd like to increase that because we know those community connections will be very powerful. Again, we'll provide program evaluation and outcome reporting as well. So we really just want to say thank you. You guys have supported us year over year in many different ways. So we really thank you for that. And we want to continue this work together and consider you all a true partner in this work.
Thank you, Ann. Appreciate the
Thanks.
information.
Yes, sir.
Any questions from board members?
I do.
Absolutely, please. Yeah, no, that's why we're here.
Ann, I've heard you mention Agape Library self-help. So how many free clinics do you all actually do annually inside of Hardeeville that, helps the residents? And where are they all held and how are they advertised so that our residents that might not know about the services can get that information?
Yes, thank you, thank you. So usually about 7 to 10 in the Hardeeville area, and we like to partner with other agencies to do those clinics, like Agape Family Life, Self-Help, and one of our medical legal partnerships, Bluffton Jasper, Volunteers in Medicine. We've recently partnered with Novant Health as one of our medical legal partners. So we will work with them and Coastal Carolina Medical Center as well. But that's a great question. We typically advertise them on Facebook and Instagram. I'm our poster. So, and we also have that on our website, lowcountrylegalvolunteers.org. So, and sometimes we get on Hardeeville TV, which is super helpful as well.
All right. Thank you, Ann.
Absolutely.
Since some of the funds are going to be used to hire a part-time person, how do you sustain that person moving forward each year?
Absolutely. Thank you for asking that, Neil. So essentially, we are asking for some additional funding from another grantor. We have a grant in the works, I don't want to jinx it, with Coastal Community Foundation to hire 2 community ambassadors for Jasper County. And that's actually why I first started talking with Dr. Young. So that would be the ultimate goal. And I think with the results we'll be able to prove, other funders will certainly come to the table.
Alrighty. Any other questions? Wonderful. And thank you so much for joining us this morning.
Thank you.
All right, next on the list, Mirasol Health.
Thank you, sir.
Thank you. Thank you.
Good morning, thank you.
Morning, thank you.
Oh, that's great. Have a PDF version. I was scared that was going to happen, so it's okay. Perfect. All right, so can I scroll this way? Okay, perfect. Good morning, everyone. My name is Ryan Pye from Mirasol Health, here to talk a little bit about expanding access and support for Hardeeville residents and families that are dealing with serious illness through our Low Country Palliative Care Program. So palliative care fills a really large healthcare gap in our community because when families are faced with the stressors of serious illness, they need more than just inconsistent appointments spread out months over months. So our palliative care team helps manage pain and symptoms and medication concerns, care decisions, caregiver support, because grief does not start with the loss of a loved one, it starts with a serious illness diagnosis, before all of those concerns escalate into a crisis. So that's where our nurse practitioners meet patients in that gap with trusted medical support, guidance, and that coordination. The two images you see on the screen here are actually, one is a letter that I'm not going to read because I don't want to cry, but it's also shows an increase in the number of patients that we have served year over year, and just shows the need here locally in our community, 108% increase in just our palliative care program alone. As I mentioned, palliative care helps with symptom management and controlling pain, but the largest goal of palliative care is to keep residents outside of the hospital. And Bob mentioned earlier, we have all these investments from Coastal Carolina, Navant, Beaufort Memorial coming into the region, but they need those beds open for true emergencies, not something that could have been alleviated at home with consistent support every week, every other day, whatever the need may be. Because the leading cause of debt in our country is medical debt. And if someone has nowhere else to turn besides going to the hospital and the emergency department over and over for a flare-up and a serious illness, they're going to end up in that same boat. And I just wanted to showcase our true continuum of care. You guys might know our organization formerly as Hospice Care of the Low Country. We rebranded just a couple years ago. We do have palliative care when the time is right, and in some cases they may transition into hospice care. And then we have a therapy, Rays of Hope counseling service for the family members dealing with grief during that and as well as after. So why Hardeeville really needs this now? I think the theme we've all been talking about is growth. It's not a secret to you guys, I'm sure. But over 40% of nearly 40% of the population is over 65, which means the need for chronic serious illness care is already here. It's not something that we can kind of plan for because it's a need that we're facing now, even when the younger growth may be coming. And we need the operations and investment into it now to make sure we can continue caring. We've been in this region for over 43 years, and our largest commitment is that we never turn a patient away based on their ability to pay. So nonprofit care is especially important because last year we provided over $212,000 of unfunded care to all patients who were uninsured, a little underinsured, because palliative care is not necessarily as highly regulated as something like hospice. So insurance typically covers about 70% of the true cost of care. We served over 230 Hardeeville residents in 2025, and that number is going to at least double according to our latest numbers that we're seeing in 2026. People are being aware of the services that are here for them, and they're starting to utilize them earlier and more often. You can see some of our clinical team, and it's actually not exhaustive list. I'm happy that we've hired 2 more nurse practitioners to serve strictly palliative care. All of these NPs you see on the screen are for palliative care in our 4-county service area. What the actual grant request will support is the operational expenses, mainly the electronic medical record software. As our patient census continues to grow, so does the need for a more comprehensive software that can care for these patients, make sure our clinicians are prepared to see them every single step of the way. And this is also a software that is now being connected to our counseling and hospice program. So if that transition comes for any patient, as they move on to maybe seeing nurses or a physician that's a little bit different than the NPs they've been seeing in palliative care, all of that information is there in one software for them. But the other large aspect is the unfunded palliative care, making sure that any and every patient here in Hardeeville gets the care based on need, not based on their financial means. And we can track every single dollar spent to make sure it stays right here within the city limits. Thank you all so much.
Right. Thank you, Ryan. Questions from members of the board?
I do.
No, it's good.
Sorry. What is your number one need that you see from your Hardeeville residents? Is it funding? Is it transportation? Or is it just something different? But what do you all see would be your number one need from them?
Funding's one. Transportation for us, fortunately, as a program, we go to the patient's homes, wherever they call home. But we are looking into transportation options in the future to help coordinate the care between specialists. So if you're going to an oncologist, our team, it's mostly nurse practitioner led in palliative care, but we do have chaplains, volunteers, social workers that are all kind of intertwined to make sure all those connections are there we can connect them with the right resources.
And then I have one other question, which I've kind of asked just about everyone. What is something that the Hardeeville community can do for your organization to help support your need and your mission?
The biggest thing is there's so many misconceptions about what palliative care is, and I don't even want to get into what hospice is because people just associate it with death and dying and shutdown. Palliative care helps people get the support they need earlier. And the biggest thing for us is allowing our staff to come and educate. We've been educating, and the reason that number of patients is going up is we're in local churches. We go to senior centers actually to take our care packs and give them some information and things like that too. And it's just showcasing what the services are. Local physicians, doctors' offices, hospitals are starting to kind of catch on slowly but surely because they're not really trained in medical school on death and dying. It's all more about save. So it's a little bit different, right? But we're educating them on when the appropriate level of care is. That way people are not turning to us at their final moments. They can live comfortably for years on palliative care, months, whatever it may be, and make the transition to hospice when it's appropriate instead of calling us with little to no time left, admitting onto hospice and not having a dying experience that was appropriate for them.
Okay, thank you.
Any other questions?
Yeah, I got a couple. So,
Okay.
First of all, with the EMR, are you connecting with some of the providers and stuff to get that information back as you transport them to a doctor, to a hospital, or services of that sort? Are you getting that data stuff back through the EMR, or is it going to be patient reporting coming out?
Yeah, everything's going to be in the EMR. So this new EMR is very complicated and above my pay grade. But it's actually we have a patient portal now into this EMR. So unlike other hospice and palliative care organizations, the patient can log on and talk with us directly instead of picking up the phone and calling, which is very convenient for especially our nights and weekends team. And it's encompassing all of our referrals will go straight into that EMR. The biggest administrative burden right now is if we get a referral from Coastal Carolina Hospital, we have to enter it into 2 different EMRs every single time. So now it's a very big undertaking to bring that all into one house, but everything is all in the EMR now.
Then the other question I had, does any of your programs kind of focus on the caregiver itself?
Yeah, exactly. So palliative care, our Rays of Hope program is by and large focused on the caregiver. Now every discipline, whether it's hospice, palliative, or Rays of Hope, is bringing our caregivers to the front and center because we see a lot of times there's burnout quick. We started last year what we called the Empowering Caregiver Series that we did 2 sessions, I believe, in Jasper County that were focused on educating caregivers about burnout and how to take care of themselves, resources beyond just hospice or palliative care, what the next step is. We're launching that again this year. We're going to do, I think, a total of 6 sessions throughout our 4-county service area with virtual options. So just educating caregivers and having a little bit of camaraderie between people who are going through similar struggles is a really big aspect.
Any other questions? I've got one for you. So it seems like every couple of days there's a new headline out about something going on with either Medicare or Medicaid, and I can't claim to make any sense of any of those headlines. But I'm curious what's happening in terms of that area. Are you seeing more support, less support? Is it creating additional needs? And if so, what does that look like here at the local level?
There's always going to be some changes that are going to require more funding from us because they're never going to sign off on something that's going to give organizations providing care more money than they can know what to do with. So if anything, it's cuts, and they're kind of looping in palliative care in spaces where it doesn't really belong. Since I've been here for about 3 years, and I've seen a few government shutdowns that delay or stop all those payments, and we have not once stopped seeing a patient in hospice or palliative care. So whether that's in person, telehealth, whatever that may be, we're making sure we're seeing those patients. And oftentimes, especially on the palliative side, we're not seeing any reimbursement from services with that. Hospice will catch up because it's a little bit more regulated. It's been around since 1982 formally. So palliative care is still a new discipline. This program itself has only been around since 2022, and it's gone from seeing 4 to 5 patients as a pilot program to now it'll probably see about 1,300, 1,400 patients this year.
Big jump.
7 nurse practitioners now, which is something we had 2 when I started. I'm thrilled.
That's good.
Wonderful. All right. Any other questions for Ryan? Thank you, sir. Appreciate you being here this morning.
Thank you.
right, next on our list is Rascals Rescue. Is Kirsten here? I don't see. Okay. All right, well, we will move on then. Next is Real Champions Incorporated. No worries. Good morning. That's Thank you.
Thank you.
Also, I'm going to age myself a little here. This is the first time I've ever used a flash drive. I was Googling, like, how
It's
to
ancient,
use-
so I get it. Like, should we talk about the floppy?
Oh my goodness.
Talk about aging.
Real old, real quick just now.
I know, right?
There is a floppy disk still in our office. No one knows how to use it, but it's there.
I still have my connector to be able to connect. No.
All right. Good morning.
Good morning.
All right, my name is Megan Tice. I'm the Executive Director of Real Champions Incorporated. I'm going to tell you a little bit about our organization. So Real Champions, Inc. is an innovative approach to mentoring. We place a paid full-time professional mentor with 8 vulnerable families. Every family in our program is a single-parent household, incarcerated or formerly incarcerated, has a incarcerated or formerly incarcerated parent, and or has experienced housing instability in the last 2 years. We work with families that have multiple complex barriers to reaching out into other mentoring programs, the top barrier being many of the children in our program have behavior issues that eliminate them from being able to continue in these other programs. By paying our mentors, we're able to give them over 100 hours of training in things such as crisis de-escalation, mental health first aid, identifying and recognizing abuse patterns within the home, etc. We begin in kindergarten through 2nd grade with children. That is because 3rd grade benchmarks show that if a child is not reading by 3rd grade, their outcomes later in life are greatly diminished. By 8th grade, if a child is not reading on grade level, their chances of incarceration are greatly increased, their chances of homelessness greatly increase. So starting at those earlier years enables us to start at the very beginning of their academic career before they start to face those barriers. And we stay with them all the way until they graduate high school. At the end of our program, our goal is that every child will be college, career, military ready. They'll be an engaged community citizen and a mentally healthy adult. In South Carolina, graduating high school is not a guarantee that you are actually college, career, and military ready. Over a fourth of students who graduated in 2024 were not actually meeting readiness standards for one of those 3 options or pathways. We are a hybrid model, which means we work both in the schools and out of the schools. We have a partnership with MOU with Jasper County School District that allows us to go directly into the classroom to provide intervention services. And then we work within the community, taking the children to things like libraries, parks, our office, and things like that. We are data-informed interventionists. So our model was designed by the National Mentoring Organization in Washington, D.C., and evaluated by University of South Carolina. In that, they found that for children with complex trauma, an inconsistent mentor can be more damaging than no mentor at all because it reinforces cycles of abandonment or lack of connection. So that is why it's so important to us to pay our mentors so that they can make sure they stay for the time period we promise the family. And then we work both in academics, soft skill development, family stability, and making sure that children have access to opportunity. Why Hardeeville Elementary students need this support now. 70% of students in Jasper County live below the poverty line. 85% of kindergarten students at Hardeeville specifically were not ready to learn. And by 3rd grade, 60% of students were not meeting expectations in reading and 55% were not meeting them in math. That means that when they reach that 3rd grade level, they are already at a significant disadvantage, that gap just has to close further and further as they move on. By putting this grant in place, we will be able to work with a new cohort within Hardeeville Elementary School to provide over 200 additional support hours in school and out of school throughout the course of the year, provide direct family advocacy, which we address barriers such as food, housing, transportation, and other needs, access to a certified reading specialist. Our reading specialist is letters certified as a former school teacher, and she actually goes directly into the school to provide intervention. So it removes pressure from the school themselves because then they know the child's getting the same level of care, but they don't have to provide it. And we provide reports to the school. We use the same systems that we use, so we use a reciprocal agreement. 12 unique experiential education opportunities. We have a strong partnership with USCB. We take our students over there every month to meet with student athletes, get tutoring, go to the aquarium. We go to the aquarium up in Charleston. We've been to Eudora Farms out in Charlotte, things like that. And then we provide dedicated support, as I mentioned, for those academic competencies, but also soft skills. We know it's incredibly important that children have perseverance, that they have a belief in themselves, that they have respect for their community. We work on all of those skills, but most importantly, I believe it's a consistent adult who will walk with them throughout their lives. This will have a ripple effect within Hardeeville Elementary. It gives more adult capacity for students who need that individualized attention. As I mentioned, many of our students have behavioral issues, which make them often either not in the classroom receiving needed instructional time or disrupting the classroom, which can derail a whole class for a whole day. When we interviewed teachers, one of the number one things we heard was, I need someone who can stop the situation before it occurs, not after it happens. It gives teachers an additional partner within the classroom to reinforce those learnings. It gives families an advocate, students the ability, stability, opportunity, and a trusted adult relationship. And then as our individual students become more stable, we believe that our broader community will as well. So your investment in the children, some of the most vulnerable children in Hardeeville Elementary, would actually have a ripple effect for the students throughout the school. I want to end with this story because I think it really encompasses what we do. 5 years ago, we had a little boy in our program. He is starting at Hardeeville Middle School this year. And we were at summer camp, and he's one of those incredibly gregarious kids. You can't help but love him. You see him come in the room, though, and you're like, oh, there's mischief happening. And I asked him, I said, well, what do you want to be when you grow up? And this normally very joyful little boy got incredibly quiet. And he said, I don't want to grow up because when you grow up, you have to work at McDonald's or go to jail. And that was the only path he saw. At the end of summer camp this year, he had just come back from a trip to the aquarium. I asked him what he wanted to be when he grew up, and he said he either wanted to be a shark wrestler, questionable, or a marine biologist. And just the jump from even knowing what a marine biologist is to believing that the path forward was prison, that to me encompasses the reason that we do what we do every single day. So thank you for your consideration. And that's it.
Wonderful. All right. Any questions from members of the board?
Yep, I do.
Yeah, go ahead.
How many students or families are currently being served in Hardeeville? I think you might have heard it or said it, but I didn't quite catch it.
We have 54 students in Jasper County, 30 of which are in Hardeeville, 7 of which are currently at Hardeeville Elementary School, and this would enable us to serve 8 more.
And then what are your tracking analytics to support the growth, especially with the schools growing, cities growing, Jasper County's growing? What are the analytics that you use to support that growth and future challenges?
To support our program, you mean? Or to how do we track the students' growth particularly?
Both.
Okay. So to support our programmatic growth, so we don't bring a child into our program unless we can guarantee that we can fully fund them for 2 years. It's a commitment that we make to the family so that we shouldn't have to we would never want a situation where we could tell a family we can't serve them any longer. We partner with many granting organizations, but our primary source of funding is individuals. So we get about 85% of our funding from individual donors in the community, about 5% from businesses, about 8% from grants, and then 2% from churches and things like that. So we're kind of spread out across the board. As far as tracking student growth, so from the academic perspective, we track their grades, their attendance records, their iReady scores, as well as their behavior in and out of the classroom. We also track the number of experiences they have access to by using reflective measures on those experiences. And for soft skills, social emotional learning, we use a program out of Johns Hopkins called Aperture EDU. So we do 3 assessments on them every year, pre, mid, and post-year assessment. It'll tell us if they are moving up, moving back, or staying consistent. And we've been using that for 4 years. So we actually have some pretty good year-over-year data for the children who started in our program.
All right, thank you. Appreciate
thank
that.
How are the kids selected?
Yeah, so we, because of our MOU with the school district, the teacher refers them. Usually at the beginning of the year, we meet with the teachers. They'll say, well, what are we looking for? And we say, we're looking for the child that by week 3 has 5 or more absences. We're looking for the child who is regularly sent out of the classroom because of behavioral problems or inconsistencies, or a child who has transferred school 2 or more times in the last 6 months. So that's how we kind of help teachers identify them. Once they are referred to the program, they're interviewed by our program director. The family does sign a buy-in form, but we make the barrier to entry for the families as low as possible. So we provide transportation, we provide a 6-week summer camp for free of charge to the families, and then again, that in-school and out-of-school support.
Are you all supported in other schools in Hardeeville as well, or is it just the Hardeeville Elementary School?
We're in Hardeeville Elementary, Hardeeville Middle, Royal Live Oak Academy, and Ridgeland.
Okay. Hartwood, not yet.
Any other questions? I've got one for you. So the MOU that you have with the school district, do they provide financial support for the programs as well?
So they provide grant letters. So last year
Okay.
we received $350,000 from the State Department of Education based on a recommendation from Jasper County School District.
Gotcha.
I love Dr. Hickson. I think she is a remarkable leader. But she said, I'm not going to take any commitment on that we will provide finances, but you better believe that we'll write those letters. So that's kind of the partnership we have with her.
Understood. Thank you.
Mm-hmm.
All right.
Thank you.
Thank
Wonderful. All righty. Keep moving right along. So next on the list is the Resource Foundation for Jasper County.
Thank you.
Morning. Thank you.
Thank you.
We can take it, that's fine.
Let's hope I also know how to use this. Okay, hi, good morning.
Good morning.
I'm Debbie Walsh. I'm the Executive Director at Jasper County Disabilities and Special Needs. You'll notice that the application, however, is under Resource Foundation for Jasper County. They are our 501c3 entity. So without them, we are not a 501c3. Resource gives us that. We are a program throughout Jasper County. We serve consumers, children, families, adults with developmental or intellectual disabilities. So things like Down syndrome, autism, all of those things. We serve people. We have a one-day program in Ridgeland. We have 6 group homes. We have an early intervention program and a community services program. We serve approximately 200 children, adults, and families throughout the county. And Resource Foundation is the foundation that was developed well over 25 years ago to give us a 501c3. So what we do, we serve in-home supports here in Hardeeville. The services we provide here include 6 community consumers who get in-home supports from us, early intervention services to 4 children and families, and we provide a transportation route to and from the center, to and from our main center here in Hardeeville for 5 consumers. We pick them up every day, bring them to program, bring them home every day. The yard crew is why I'm here today. We have a yard crew that provides lawn services, which is good for the consumers and good for the people. The crew is based with community and residential consumers, people who live in the community with their families, and people who live in our group homes are served. They both are on the crews. We have over 40 contracts a month. Right now, there are 3 of them here in Hardeeville. We'd love to expand the service in Hardeeville. Each of the crews consists of 9 consumers and 2 staff members. They arrive at the day program around 7:30 in the morning, start loading vans, and work their way through their contracts. They usually have about 4 or 5 a day. That includes mowing, blowing, raking, weed whacking, and they're essentially participating in running their own business along with the staff. They work about 4 hours of the 5.5-hour program day, and they're all paid minimum wage for everything that they do. To maintain those crews, we utilize 2 15-passenger vans plus trailers, 3 riding mowers, 2 regular mowers, variety of blowers and weed whackers. These items are utilized 5 days a week because they come to program every day, and so they require ongoing routine maintenance and periodic replacement. Here we have somebody in action. We've got somebody on a riding mower. He's doing a great job. They've got them weeding on one of the other contracts, cleaning up after themselves, picking up all the debris, putting everything where it belongs. What do they get from this experience? They're learning a lot of skills which can help prepare them for possible competitive employment in the future. The staff includes them in all their details regarding the businesses, their schedules, pricing out new contracts. It also assists with their inclusivity and visibility of the population that we serve. Getting them out there amongst the community is good for them. It's good for everybody. Provides them with increased self-esteem and productivity within the community. Also gives them funds to give back to the Hardeeville community. They do most of their shopping there. The grant objectives would enable us to acquire and maintain more equipment, which would then enable us to hopefully seek out more contracts in the Hardeeville area. We can get further if we have more to work with, so to speak. Can assist those with yard care needs at a reasonable price, giving back to the community. The goals of the program for the consumers and everyone: increased business presence and awareness in Hardeeville of our agency and the service opportunities for the Hardeeville citizens, increased income for the consumers, increased consumer self-esteem, community inclusiveness, and productivity. And there we are. There's one of the crews posing. They do an excellent job.
Wonderful.
Questions for me?
Thank you, Debbie. Any questions by members of the board?
I do.
Please, go right ahead.
Yeah. You say they have contracts, so there's a charge for the service?
Yes, yes. Currently, they're charging about $60 an hour for yard maintenance, and they do, it's generally once a month or twice a month, depending on the season, for each contract. So the contracts are with our agency, and then we put them out there. We don't make money from that. The consumers get the funding from that. The rest of our funding comes from the state to run any program we have.
Thank you.
Sure.
Any other?
Sorry. Do you partner on contracts with any of the schools or civic groups or
We
any
don't-
other private entities in and around?
We don't partner with them, but we do have some of the lawn contracts. We serve a variety of other businesses and organizations and private homes in the area.
Wonderful. Okay. Any other questions?
How are the contracts obtained? Is that
A lot of it's word of mouth. We just got 2 that somebody called and said they heard so-and-so was getting their lawn done by us, and they wanted it done as well. They will come into our adult services, the day program director, essentially, will get the initial phone calls or referrals for that, and then she figures out with the crew when they can do it and how often.
So would they contact your organization to do the contract if it was something that they wanted? Like-
Yes.
Okay.
Yes. They would contact us right there.
Oh, perfect. Any other questions? All right. Debbie, thank you so much for the information.
Thank you.
All righty, we will keep moving along. Looks like next on the list is second helpings. Good morning.
Still morning? Good
It
morning.
is.
Thank you.
Thank you, Amy.
All right. Good morning. I'm Amy Colin. I'm the Executive Director for Second Helpings. Thank you for having us here today. Last October, when the SNAP benefits were suspended, the very first call that we got was from Gloria's Church down the street. The very first call she got was from a school teacher here in Jasper County who was worried about how she was going to feed her family. Last fall, our agency saw a 20 to 30% increase in the amount of people who needed their services. Second Helping stepped in. So 85% of what we do is rescuing food. That was our original mission 34 years ago. For the last 10 years, we've been able to purchase additional proteins and produce and shelf staple pantry items that we deliver to 57 food pantries free of charge. So when that happened last fall, we responded. Unfortunately, even though the crisis passed, the need has not decreased. 74% is the number I want you to remember. We serve 5 agencies here in Hardeeville: Agape, Creative Church, Glorious Church, Healing Waters, and Mercy Mission. 74% of the food that they are distributing to the citizens of Hardeeville came from Second Helpings. Some of it starts here. We pick up from 33 different retail locations. 2 of them are in Hardeeville, Walmart and Publix. We also partner down the street with Rule at Hardy Greens. But 31 of those stores are still in Beaufort County. We know that that's about to change. Unfortunately, the local need definitely outpaces the local supply. Feeding America estimates that in Jasper County, there are 5,200 food insecure people. 2,000 of those residents live within the city limits of Hardeeville. Hardeeville's growing. That's why we're here, right? New stores, new restaurants, new people, new need. Second Helpings is the organization that is in place to help meet that need. We currently have a fleet of 10 trucks. We operate 6 routes, 6 days a week in food rescue, and the other 3 trucks are operating in our purchased food industry. This year alone, we've rescued over 12% more than we did in 2025. We've purchased more than 45%. One of my biggest challenges is the fact that people want to fund a program and people don't want to fund food rescue operations. We currently receive 2 grants that are specific to Jasper County, and both of them are for food purchases. Our fuel increase was 31% so far this year. You can imagine. I'm currently supporting New River Transmission here in Hardeeville because we just had 1 transmission rebuilt. We're getting ready to do a second one, and they're getting ready to do some preventative maintenance on all of our trucks. Our trucks are expensive. 441,000 pounds of food were brought into Hardeeville last year to feed our neighbors. Second Helpings delivered 3.7 million pounds of food last year across the 3-county area. I want to grow, and I want to grow with Hardeeville. And the only way that I can do that is increase partnerships in Hardeeville and Jasper County. If we receive this grant, it will be the first grant that we have received that is for food rescue operations in Hardeeville. So on behalf of the 5 agencies that we currently serve, the agencies that are coming, and the people that need it, opportunity today. Thank you.
Thank you, Amy.
Yeah.
All right. Any questions from board members?
I don't have a question. I just want to, I want to say thank you. We work with the Low Country Church, which is, one of the pictures that you've got up here too, to be able to provide that service. And when I tell you that the different types of vehicles, a lot of people think that, food insecurity is just for those that are unhoused or poor.
Right.
It is not. And we have a ton of people that come through our back rec complex back here, and it literally wraps around. So thank you for what you do.
Yes, it's my honor. The very first time that I came here to speak to the city, it was the evening that they were serving out there. And I thought, oh my gosh, what's happening here? And then I realized, oh my gosh, they're feeding people. So then we partnered with them. They don't have a way to accept rescued food at this time. But when we can, we definitely partner together.
Yeah, we appreciate everything.
Yeah, thank you.
Great.
Anyone else?
Thank you so much for being
Thank
here.
you. Oh, did I? Oh, you didn't get my thank you slide. That's okay.
That's all right. And last but certainly not least, the self-help group.
Went from the top of the list to the bottom.
One of the disadvantages of the name change.
Oops.
The irony is not lost on us.
Thank you.
Thank you.
Thank you.
Okay. So, like you said, self-help, we have intentionally kind of went away from Bluffton to just acknowledge the communities that we serve. My name is Carly Anselmi. I'm the Director of Development at Self-Help, and it's a privilege to be with you all this morning. As I'm sure you've seen in our application and through our partnership in the past, we've been serving the Low Country for almost 40 years now. We focus on holistic support, access to basic needs, as well as building capacity through education and workforce development. We saw a need in Hardeeville first within the education space. We started serving at the rec center as well as the library and teaching classes to the community. We saw that there was more need for all of our classes as well as additional programming. So in June of this year, we opened up a new permanent home right off of Speedway Boulevard. It was a $1 million investment into the community to offer all of our services. So with that jump, as of June, we saw an immediate 5% increase in number of households served through Jasper County. That means that July 2026, 22% of our households served reside here in Jasper. It's kind of showing that that need was met and that we're really excited to offer our opportunities down the road. We offer access to free food through our mobile market. It's a refrigerated truck that we bring out into the community to deliver fresh groceries. Our goal is to partner with local nonprofits that might not have refrigerated foods that we can pop up and offer that assistance. This week, we also offered our mini market, which we're calling it, in our new Hardeeville location that gives groceries to our students who are taking classes in this new location. As I said, we started with education and workforce development to begin with. So fall 2025, we had about 40 students who came into the classroom with us. I'm proud to say that as of this fall in Hardeeville, over 100 students came and took classes with us, really showing that the need was there. Like I mentioned, this allowed us to bring all of the class offerings that we had, as well as additional programming. One of the things we offer in terms of basic needs is emergency financial assistance. This is a one-time help you through a hardship situation that we pay out directly to our neighbor. Last year, we gave out about $30,000 to Jasper County residents. As of July of 2026, we've already distributed and invested $28,000 already to Jasper County. We expect that number obviously to rise and increase with our increased presence here in Hardeeville. As we know, and as you've seen from all the presentations that we've had today, partnership is at the key of what we do. So collaboration is huge. We've all mentioned each other's names. We have been really proud to partner with the city of Hardeeville in the past and continue to in the future. In our space, we have some intentional places to offer that partnership. We have a dedicated partner lab as well as a community room that we want to invite the community as well as other nonprofits to offer shared services
under one roof. Transportation is a barrier for a lot of our neighbors. So bringing other organizations under one roof so you don't have to bounce from one agency to another is really key to our success and to assisting our neighbors. We're asking for your investment, which sounds like a Shark Tank reference if anybody listens to it, but we are asking for your investment and to continue our partnership together. We're asking you to invest in adult education. We're asking you to invest into developing our workforce. We're also asking you to invest in our case management program, one-on-one individualized support, where we're able to connect our neighbors to different resources, whether they are self-help or whether they're with our other nonprofit partners. Hardeeville is growing. Self-help is committed to growing alongside you, and we want to make sure that the neighbors in our community have the access and the resources they need to grow alongside all of us as well. Thank you.
Thank you so much. Questions from members of the board? All right. I can tell we're getting a little bit tired at the end of the day. Yes.
I don't have any questions. We're very familiar with the program.
We're all trying to wait to see if Jennifer has one, and we got to figure out ours.
You guys do a great job.
Yes. No, thank you so much for being here this morning. We really, really appreciate it. Okay. All right. So next item on our agenda was board member comments, open discussion. I know we've spent a better part of 2 hours now. Do we need to take a little bit of a break? Do we want to keep plowing through? What's the desire of the board?
I would suggest that we kind of let these people
Okay.
know the next actions, what we're going to do before we. So
Yep. So I think one of the things that we're going to take away from today, we've got a scoring matrix where we're going to take the information and the presentations that we've received today. We're all going to score those based upon the criteria that Neil has helped put together for us. So that looks at organizational eligibility and the application completeness, the mission alignment and project purpose, demonstrated community need, program and project design and scope. I will tell you, I was hoping that this exercise would have made this job easier for us, and I really don't think it has. So I know we're going to need some time to really be thoughtful about these presentations because they were all really, really well done. So I don't think we're going to be able to give you any direct feedback today, but please know that what's likely to happen is we will probably reconvene either in person or through a virtual meeting in executive session so that we can then compare our scoring matrices with one another and then start making our funding recommendations. And then ultimately we'll publish that information and we'll distribute it to all of you prior to it coming forward, okay? Any other questions we need to cover from that standpoint? All right, well, let's go ahead and we'll let everybody go then. And then if we want to take a quick 5-minute break and then we'll kind of talk about where we're going next. Okay. Golly, that's it. I was hoping there was going to be some low-hanging fruit, which is just okay. It's great, but just not really for our area. And I don't know because it's all really, really valid stuff. So, yeah, it's a good problem to have in some regards, but. Much separation that's going to create from one another. I think it's still going to require some discussion amongst us about what do we think is the best way to skin that cat.
Just know that we have approximately $100,000 to fund grants this cycle. I think when I tallied those up, it was probably $300,000 across the board for the 14 that we had. So we do have some decisions making stuff to do there and what kind of process we want to do selecting these grants.
Is our goal to try and, I know the percentages, once we do our scoring sheets, will certainly help allow us to figure out what those pricing is, but is it to try and give a little bit of whatever that funding that we have to everybody, or is it to really nail down, these guys have a better option, I'd rather put that funding here versus they've got this, let's give them $1,000, where that $1,000 could have a better impact.
And that's a good question. That's a question for this group to kind of, decide upon. Do we want to represent percentages of almost everybody? Or do we see a couple that we say, hey, we want to go to the full ask amount for those? So.
Well, I'll go.
Yeah.
Personally, for me, presentation is really key. You get a lot of information from it. And I know that sometimes if we've got a $25,000 ask and the project is, I don't know, $25,000, sometimes it makes it easier to just boop, give it away. But I want to make sure that the amount of money that we're giving really does have a community impact. And particularly if there's something that's a startup that doesn't have a lot of analytics to it, I'm a little more leery less to give money versus something that's tried and true and proven and that I can see those results. But that's just me personally. Versus just giving someone $1,000 and saying, here you go.
Yeah.
But I don't know how everyone else feels.
And ideally, as far as process, I could see us probably within 3 weeks having some sort of award letter type thing back out to the groups. Even though that it would push us probably to the beginning of October before checks would be released.
Yeah,
I mean, about 3 weeks probably would give us enough time
Faster than last.
for us to go through and score, us get back together, convene, and make the recommendations on award. So.
Would there be any opposition to like looking at each of the different asks and the breakdowns and everything, and maybe not it not being even across the board, but if we were to try to do a little bit more than just, let's say, 4, could we kind of distribute it out based off of, okay, well, it could help a significant portion of this if we were to provide it.
And one thing about it, and I know, Kelly, we just thrown you right in with the mix on this, is that we actually established a scoring matrix that does based on percentages of our reviews. So based on that, it automatically, nobody gets like a perfect out of that scoring matrix. So it does reduce some of those amounts and does kind of distribute more evenly across the board. So, I mean, that's probably the first way we can look at to see if that, I mean, and then if we come back and we reconvene and say, no, we want to see this one, that's what I think at that point it's when we say, these are the ones we recommend or whatever, so.
Yeah, I think both options are kind of on the table because it's really hard to listen to all these proposals and figure out which ones aren't really valid. I mean, they all have some level of merit to them, so it's really hard. But there's a case to be made that just taking a flat percentage across all of them probably isn't the most effective way.
That's correct.
So I kind of see it being a little bit of both. I think maybe we focus on a couple of projects where the connection's clear, the impact is demonstrated, and they've got maybe a track record of success where, okay, those get funded at or closer to the request, but maybe some of the other ones are a percentage of it.
Yeah, I agree.
So we're kind of accomplishing a little bit of both. But I think at the end of the day, both options are on the table, and I would hope that the board members feel comfortable advocating for either if you feel strongly having thought about these proposals. One thing that I kind of feel strongly about, but it's a contra point, which is if you're not here to present, I'm going to struggle to fund you. And I know that that's hard because Rascals Rescue is a great organization. We partner with them directly for some other services, but I can't feel comfortable justifying making it a recommendation if they're not here and everybody else is.
Right.
So I don't know how the rest of the board feels about that, but I know personally that's something I'm gonna look at. And then I think not for this year, but maybe for next year, something else that will help us contextually to understand these is maybe for some more financial information from these organizations to really understand, is this filling a gap that's otherwise going to go unmet, or do they have the ability,
and we do have that information with these applications.
Okay.
And the reason I sent the application out, it does have the attachments.
Okay.
So you can click on it as a hyperlink. So the attachments do talk about, that's some of the things we asked about was the financials.
Good.
But for us to print out each one of those.
No, that's
we
fine,
got
as
1,000
long
pages
as
for
we
all
have
of it.
access to it.
Yeah, so we
Like,
do.
because I'll tell you, for mine, the Mirasol, the hospice care of the Low Country, because they've been established here for the better part of 40 years, they have a pretty good donor base. And I know that they do a series of fundraisers and other stuff. So I would expect to see then a balance sheet that reflects that. But I was wondering if maybe we could use that to figure out true programming needs.
And I think I asked, as far as the application, last 12 months financials, I think maybe the last audit or something of that sort. So there's some good stuff that they've submitted. So if you look through there, of your application I sent out with the PDF actually has their links of uploads in there. You just click on it and it'll bring it up. So.
All right. So Neil, am I to understand you want us to take this for each one of the little these sheets?
I actually had sent that information out in the spreadsheet as well. I just printed one hard copy of it. So yeah, so basically we're taking each one of those score sheets and trying to make our way through the applications that we provided before we reconvene. So.
And I don't know if it's just my packet. I was missing some of these sheets, little summaries.
I think mine was just,
Maybe it was the Bluffton Jasper Volunteers in Medicine.
Okay.
And then the Jasper County Council on Aging. Did you
Take
have?
one of these.
I had them on.
It should have been on them, but printer, it may have missed a couple. I don't know. So.
Okay. Well, if you have it, if you'll just, I'll send
Yeah,
it.
I mean, and you have that in that spreadsheet I shared as well. I just condensed this so we can have some print quality of what we was talking about today. So.
Okay. This works for me. It's easy to come through it.
To use that, good. Okay. John, any other thoughts?
Virtually is a lot easier.
Yeah.
And this way we can at
Okay.
least discuss, have all that information, and then if we can get that back and you can get that matrix.
Well, I was gonna say, so
we can figure out percentages. I don't
maybe
know
the
if we need
thought
to
could
do
be,
two follow-ups
yeah, I
or
was gonna say, let's score everything. Email the score sheets to Neil so that you can then put together a combined summary that we can then review together virtually, and then talk about, do we want to use that as the funding schedule, or is it just, that's a guide and we can still make some changes ultimately one way or the other?
And one good thing about the virtual, if we have a question about a particular application, we can just bring it up and kind of work through the application while we're online, so everybody can see.
And how much do we have again? One?
We have 100,000, and I think I estimated right around 300,000 worth of applicants. So.
I want to be respectful of y'all's time. What turnaround period do you think would be necessary? Because I know we got, what, 16, 15?
14, I think.
14.
14 total.
So 14 proposals to go through. I don't want to overtax you, but we think maybe 2 weeks?
I have, I'm leaving on the 2nd, and I won't be back till the 14th.
Okay.
So maybe have all the information back to us by September 18th. That gives you time once you get back to work through that, plus everything
3
else you got
weeks?
to do. So.
That works for me.
Okay.
All right, so have your scoring summaries back in to Neil by the 18th, and then we'll see if we can maybe schedule a virtual meeting sometime early the week of the 20th to go over those and make that a recommendation by the end of the month.
Yeah, that works.
Wonderful. All righty.
So have it back to you by the 18th?
By the 18th. And Kelly, again, thank you for joining
Yeah.
us.
I was gonna say, jump right in, but
For you, the wolves.
Yeah, that's what I said to her.
That's what I learned.
This is the hardest one, the meeting is the longest.
It,
Get right in the deep end.
Kelly and I sat on another board together too, but it's kind of a little different here.
Having addressed all of our agenda items, actually, I'm going to make sure it's clear. We do not need an executive session at this time, so we will move on to the last item on the agenda. Can I have a motion to adjourn?
Motion to adjourn.
And a second?
Second.
Motion and seconded. All those in favor indicate by saying aye. Aye. Any opposed? We stand adjourned. Thank you all very much.